think if our public health system, as far as a true public, I'm talking about hospitals and all that stuff isn't really what you call the public health system, but
right.
We had a much better. If our public health system for this country needs a lot of attention, because there was no coordinated effort. There was no real guidance. And again, I think there was a lack of trying to really get that testing ramped up as faster that because quite frankly, if we had testing and if they knew how to, they would have been able to have been better prepared for it. We may not have had to actually shut down economically, because the whole thing is, and I don't think people really realize, okay, it was like the flu, but it was a lot more devastating health wise. And the bigger thing about it is it wasn't so much, I think some people get lost when they watch these, like these movies on pandemics and these outbreaks and stuff like that, which the disease is a lot more deadly. And they think, okay, you're gonna I could just imagine people thinking they were going to see, ambulances coming up to houses on a regular basis, and kind of what you see in those movies. But I don't think what people realize when you compare it to that and saw this, you're like, well, what's the big deal? It's like the flu. Yeah, it's a higher mortality rate, but it still had nothing to do with that. It's just that our healthcare system is not set up for mass, a pandemic like this. So the bigger issue became overwhelming our resources. And, this disease was bad enough to where it could put a lot of people in beds, take up a lot of resources, take up a lot of doctors' times, to where some of the things that we kind of take advantage of, that we kind of, take for granted, all of a sudden would become less serviceable. And, your fatalities would be more than just COVID. It'd be like people that could have, put it, like I said, our resources were so thin. How many people put off elective surgeries that cost them down the road, or how many people may not gotten the level of treatment they would have gotten if you hadn't had pulled doctors and nurses away to COVID wards. I mean, I don't think people understood this is about resource allocation. It had nothing to do with the disease itself. It just was a bad enough disease that it was going to cripple our hospital system, which we did see happen.